As the world events happen, people coming into the city are different than what we've had for the last 20 or 30 years. And so we have to be just as open, just as flexible, just as culturally competent for them as well.
He is brilliant. First of all, he's very brilliant.
He's very bold. To advocate for the needs of a community health center like ourselves, sometimes you need to be very bold.
He's constantly at the health center, and I always say, I don't know how you do it.
He's at the board meetings, advocating for us. Bruce is everywhere, always there for our patients, always there for our staff. And when I walked in here, I was like, oh, voila, Bruce is here. Bruce, you know what I like about this place? Bruce is very personable, he's very real. What you see is what you get.
In the summer of 2020, 2 days before our board meeting, I get this letter asking the council to do a few things to advance racial equity within our city. I called Bruce. Within moments, he said, this is our community saying they need this from us because they cannot achieve true overall health and well-being without a recognition that racism is the cause. He was there. And so was our entire board. Because of the way he can speak to the importance of racial justice, every single one of our board members voted in favor of declaring racism a public health crisis.
Our board took a stand that racism is a public health crisis. And while many in the city were hesitant to do that because they felt the city wasn't racist, and we weren't saying that. What we were saying is there are situations that people live in that block them from getting access to health care in a way that other members of the population could. At every board meeting, we're looking at who are we serving, how are we doing it. We look at our hiring practices, we look at the training for our staff members, we look at the diversity of the board. It drives us in every issue because at the end of the day, if we're not serving the needs of the populations we serve, why are we here?
And that is exactly who Bruce is. He is the power behind this health center, making sure that we do what is right and what is just for our community.
We're very, very different on our board. They're diverging opinions, and I watch him bring us all together, and everyone is still happy and pleased with each other, and I think that is just such an admirable quality.
I had the privilege of serving on many boards. I've never served on a board where we had interpreters for board members in the room. And that, coming from a local suburban community, was an eye-opening experience for me. And it just taught me how to learn and appreciate and open yourselves up to the cultures of other people, because everyone, and I mean everyone, has something important to offer.
Say, what do you think? Any ideas for dinner tonight?
Yeah, I thought maybe we'd try that new Cambodian restaurant downtown.
You know, we speak 29 different languages here at the Lowell Community Health Center. So if we have a problem with the menu, I know where we can get some help.
That's great. Let's go.
All right.
Diversity has always made everything better, and I just think people are missing out if they don't open themselves up to it.